Hello everybody. So today yet another we are going to continue with the bandages. So the next topic which we are going to discuss on bandages is that principles. So far we were discussing what is the major purpose, what is the difference between a dressing and bandage, and what is the possible solutions or for maybe possible types of bandages and so on. So in this video, we are going to cover about the basic principles of bandage. So before going into the topic, we all have come across principles, which is nothing but the rules and regulations, or you call it as in simple terms, the do's and don'ts of why a bandaging is being performed. So the first and foremost principle is that select a bandage of proper size with suitable material. So the material might be yesterday as we discussed in the previous video, like might be what is whether it is of elastic material or a cotton material or jute material, and the size of the bandage as per the rules, like what is the length and width must be planned before you apply onto the particular area. Put the patient in a comfortable position, always never like you don't go and force the patient to do so. Instead, just calmly listen to what the patient is feeling and what can be done during the procedure to minimize the pain for the patient. And yes, you're going to give a good position. Then always see that whenever we are going to do the bandaging, we have to support the extremities, especially the joints, so that it is not worsening much more. And if a joint is being flexed, involved, always it is advisable to flex the joint rather than holding the hands very straight. So you can advise the patient to flex the joint and you can do the bandages. And always say that we are facing the patient when we are applying the bandage. It's except for in case of a capillary bandage which is being done on the head, the other bandages are always applied just facing the patient forward. Moving on to the next general principles, always hold the roll of bandage in the right hand and applying on the left, and see that the bandage is always being rolled uppermost, that is at least two twines or two twists must be taken in the starting of a bandage as well as while you end the bandage. And always put the cotton or wool on the part of the bandage in case there is high chance for abrasion or might be friction. In those areas, try to apply the cotton. For example, if you're going to give bandages for the fingers, so in between the fingers you can apply the cotton or wool. And if it is involving the toes, then between both the toes or one or more toes, you can apply the cotton or wool. Bandage always must start from like below, that is from upward, from it should go in a fashion from up and down, and as well as from within and outward. So from inside and outside we have to start the bandage. Always hold the end of the bandage over the outer aspect of the injured area, and we have to twine or you have to wind the bandage in such a way the part is being twice fixed. As I told you earlier, so before you start a bandage on a particular side, two turns have been taken when starting as well as two turns while you are doing the finishing time. When bandaging a limb, always we have to start in oblique turn in order to maintain the muscle integrity when you are going to do the bandaging. And of course, see that always cover two-thirds of the bandage one after the next while covering the larger area. By winding the roller bandage apart, keep the edges always parallel to each other. So it should be in a neat and appropriate fashion, not having twists and turns in between. And see that the bandage must not be too tight or too loose in order to as it may compromise the circulation, and if it is too loose it might not meet the purpose of bandage. So always finish the turn by doing two circle turns, and you can fix it by a safety pin, or might be in some of the crepe bandages the safety pins have been given, so that with that you can fix the bandages, or you can also use the adhesive plasters to fix the bandages. And if possible, we have to Always see that you're exposing the fingers and the toes whenever you're closing the bandage, so that we can see whether the circulation is adequate or is there in any compromise in the circulation. And see that you're not tying the bandage too tight or too loose. Always it should be in the exact fixing circle. And always we have to closely monitor for any signs of swelling or blueness, because that may be a early symptom to find whether the bandage is tight or not. And when removing the bandage, pass it from one hand to the other hand so that it is collected in a concrete fashion. So some of the common terms which you will be coming across in the further videos when we are discussing in the practical session is that simple spiral, reverse spiral, figure of 8 and spica. So these bandages will be taught in the practical session in a more elaborate way. Please wait for that video. And some of the these are the common questions that will be given in the bandages, like might be principles of bandage, many tail bandage, or they may ask for 2 marks, spica bandage and reverse bandage. So this is a 5-minute assessment of what are the basic principles of bandage that can be covered in the university examination. And these are the possible references which has been done in bandages. Okay, thank you so much for your patient listening. Hope you will be waiting for my practical session on the different types of bandages that will be uniquely presented so that it will be easy for your understanding and learning purpose. Stay tuned to watch more videos. Don't forget to subscribe and like my channel, and please do follow my channel. Thank you.